The dog came in through the emergency bay doors at 11:47 on a Tuesday night, and the first thing Tara Weston noticed was the blood. Not the two soldiers in full combat fatigues carrying him. Not the handler, a sergeant named Briggs, though she wouldn't learn his name until later, whose hands were shaking so badly he could barely hold his radio. Not the third man in civilian clothes who kept repeating, "He's a military asset. He needs a vet facility," into a phone that nobody on the other end seemed to be answering. The first thing Tara noticed was the blood, because the blood was everywhere, and the dog was still trying to lift his head. That's the thing people don't understand about German shepherds. Even when they're dying, they're still trying to do their job. She was at the end of her shift. 12 hours in the ICU, 2 codes, 1 family she'd had to sit with in that small beige room off the waiting area and hold someone's hand while a doctor said words that nobody ever wants to hear. She had her bag over her shoulder and her keys in her hand, and she was 40 feet from the exit when the doors opened and the dog came in and she stopped walking. The on-call physician, Dr. Lind, was already backing away. "This is a human hospital," he said, and his voice had that particular tone that some people get when they've already decided what they're going to do before they've even assessed the situation. "We don't have the equipment." "He's bleeding out," Tara said. She wasn't sure she intended to say it out loud, but she did, and everyone in the lobby turned to look at her, and Dr. Lind said, "Nurse Weston, this is not our jurisdiction." She had already set her bag down. Later, she would try to explain it to people and find that she couldn't quite get the words right. It wasn't that she forgot the rules. She knew the rules. She'd known them for 5 years, since the day she graduated from nursing school in Nashville and took her first job at Mercy General, and learned that hospitals run on protocol the same way they run on electricity. Without it, everything goes dark. She wasn't naive, she wasn't reckless. But the dog was still trying to lift his head. His name was Kodiak. She didn't know that yet either. What she knew in that moment was that there was a living creature bleeding on the floor of her hospital, and she was a nurse, and she had 2 functioning hands, and the math on that was pretty simple. She knelt down and started working. The handler, Sergeant Briggs, she would learn, 23 years old, from Dothan, Alabama, had tears running down his face and didn't seem to know it. He told her what had happened in fragments, the way people do when they're in shock. Training exercise outside of Fort Campbell. Concertina wire, low light. Kodiak had gone through a gap that wasn't there and caught his left foreleg on the way out. Arterial, maybe. They were 40 minutes from the nearest military vet facility, and someone made a call. The wrong call, according to at least 3 people in that lobby. The right call, according to Tara. She used what she had. IV line, pressure dressing, the saline flush that she grabbed from a supply cart while the intake nurse watched with her mouth open. She talked to Briggs while she worked, not because she needed information, but because she needed him to stay present, stay calm, stay out of her way and not faint on her. "What's his name?" she asked. "Kodiak," Briggs said. "How old?" "6. He just turned 6 in March. We celebrated. I bought a steak from the commissary." His voice broke on the last word. "He's going to be okay," she said. She didn't actually know that yet. But Briggs needed to hear it, and Tara had learned a long time ago that sometimes a nurse's job is to hold the certainty for the people who can't hold it themselves. She got the bleeding slowed, not stopped. She didn't have the surgical capacity to stop it, but slowed, stabilized, bought enough time. She found the one veterinarian on call at the civilian animal hospital 2 miles away and talked her through accepting a military working dog as an emergency transfer. She organized the transport herself. She handed Briggs off to an orderly when his knees started to go and told the orderly to get him water and a chair and to please, for the love of everything, stop letting him pace. The whole thing took 43 minutes. She didn't think about her job once. Her supervisor's name was Carol Maddox, and Carol Maddox had been the nursing administrator at Mercy General for 11 years. And in those 11 years, she had built something that she called a culture of accountability, which mostly meant that she had very strong feelings about paperwork and very little patience for what she called cowboy medicine. She was waiting in her office when Tara came in the next morning. Tara had known, on some level, that this was coming. She'd gotten a text from one of the night nurses at 2 a.m. that just said, "Heads up, Maddox is in early," and she had lain awake in her apartment for the rest of the night, not quite sleeping, staring at the ceiling and listening to the neighborhood wake up around her. A garbage truck. Someone's car alarm. The particular stillness of 4 a.m. that always felt to her like the world was holding its breath. She dressed carefully. That was the only preparation she made. Carol Maddox did not offer her a seat. "You treated a non-human patient in this facility," she said. She had a manila folder open on her desk, but she wasn't looking at it. She was looking at Tara, without authorization, without physician oversight, after Dr. Lind clearly stated. Dr. Lind stated it wasn't our jurisdiction, Tara said. "He didn't order me to stop. He didn't think he needed to. You're a nurse, Weston. You don't diagnose, you don't treat, you certainly don't make unilateral decisions to turn this facility into a veterinary clinic." "I stabilized a traumatic bleed," Tara said, "with materials from our supply. I can account for every item I used. That's not the point. Then I'm not sure what the point is." "Carol Maddox, close the folder," she said, "is that this hospital has liability. The point is that our accreditation is tied to protocols that exist for reasons. The point is that I cannot have nursing staff making independent decisions about who or what receives care in this building, because the moment I allow that, I've lost control of this entire facility." She paused. "I'm placing you on administrative leave pending a formal review." Tara looked at her for a long moment. "He would have died," she said. "He's a dog. He's a military working dog who has served this country for 6 years, and he would have died on the floor of our lobby while I watched, and I wasn't willing to do that." "That," Carol Maddox said, "is exactly the kind of thinking that gets nurses fired." She wasn't wrong about that part. 3 days later, Tara got the letter. She was sitting on her apartment steps when she read it. That was where she tended to go when things were difficult. Not inside, not at a table like a functional adult, but on the front steps with her coffee going cold in her hand and the neighborhood moving around her like it always did, indifferent and ongoing. The letter was formal and thorough and covered every angle of the situation in language that had clearly been reviewed by the hospital's legal team. She read it twice. Then she folded it and put it in her lap and watched a kid across the street try to teach a younger kid how to ride a bike, and the younger kid kept falling, and the older kid kept pulling her back up, and they were both laughing. She thought about calling her mother. She thought about calling her friend Danny, who was also a nurse, who would be appropriately furious on her behalf and would probably bring wine. She thought about calling the union representative whose number she'd never used and always kept in her phone anyway, just in case. She didn't call anyone. She just sat there. This is the part that's hard to explain about losing a job you loved. It's not just the practical stuff, the paycheck, the schedule, the routines that structure your life. It's that you have to figure out who you are without it. Tara had been a nurse since she was 25. Before that, she'd been a nursing student. Before that, she'd been a girl from a small town outside Clarksville, Tennessee, who'd grown up watching her grandmother manage a household of 6 kids and 2 jobs, and still somehow find time to sit with the neighbor who'd just lost her husband, because that was what you did. You showed up. You showed up for people, even when it was inconvenient, even when nobody was watching, even when the rules said it wasn't your department. That was what her grandmother had taught her. That was what she'd carried into every room she'd ever worked in. And now Carol Maddox had put it in a manila folder and filed it under terminated. What Tara did not know, while she was sitting on her steps with the letter in her lap, was what had happened at the animal hospital 2 miles away on Tuesday night. She didn't know that Kodiak had made it through surgery. She didn't know that the veterinarian, a woman named Dr. Asha Brennan, who'd been doing emergency large animal work for 12 years, had said afterward that whoever stabilized that dog had known exactly what they were doing, that the pressure dressing alone had probably saved his life. She didn't know that Sergeant Briggs had been at the animal hospital until 4 in the morning, sitting on a hard plastic chair in the waiting room, and that when Dr. Brennan came out to tell him the dog was going to be okay, Briggs had put his face in his hands and stayed that way for a long time. She didn't know that Briggs had asked who had stabilized Kodiak, and that the intake nurse at Mercy General had told him. She didn't know that Briggs had gone back to Fort Campbell and told his commanding officer exactly what had happened. She didn't know what his commanding officer had said in response, or who that commanding officer had then called, or what conversations had taken place in the 48 hours after she was handed her termination letter. She was sitting on her steps, watching kids learn to ride bikes, and she didn't know any of it. The call came on a Thursday afternoon. It was a number she didn't recognize, with a 615 area code, and she almost didn't answer. "Is this Tara Weston?" "It is Ms. Weston. My name is Major Lawrence Pruitt. I'm with the United States Army, Fort Campbell. I'm calling because I understand you were recently let go from Mercy General Hospital." She set down her coffee. "That's correct. I also understand you're the nurse who stabilized Kodiak on Tuesday night." She was quiet for a moment. Is the dog okay?" There was a brief pause on the other end of the line. "He's recovering. His handler visits every day. He's already trying to eat everything in sight, which the vet tells us is a very good sign." Another pause, and this one felt different, like the major was choosing his next words with some care. "Miss Weston, I'm going to ask you a question, and I want you to know you're not obligated to answer it, and whatever you say doesn't commit you to anything. But I'm going to ask anyway." "Okay," she said. "How attached are you to the city of Nashville?" She found out later that there had been a meeting. Not a formal one, no conference room, no PowerPoint presentation, nobody taking minutes. Just a conversation, the kind that happens in hallways and mess halls, and over coffee in places she would never see, between people whose names she would probably never know, about what had happened at a hospital in Nashville on a Tuesday night and what, if anything, should be done about it. She found out that Briggs had not been quiet about what he saw, that he had told people what Tara had done, and that the people he'd told had told other people, and that at some point the story had reached someone who had the kind of authority that makes phone calls happen. She found out that 2 days before she got the letter from Mercy General, someone from Fort Campbell had called Carol Maddox. She never found out exactly what was said in that conversation, but she had some guesses. The morning after Major Pruitt's phone call, Tara drove to the hospital. Not because anyone told her to. Not because she had a plan. She drove there because she needed to do something with her hands, needed to be somewhere that wasn't her apartment, needed to move. She parked in the visitor lot. She'd had to turn in her employee badge, so the parking structure was no longer available to her, and sat in her car for a few minutes looking at the building. She had worked in that building for 4 years. She knew every hallway. She knew where the supply closets that weren't on the map were, and which elevator ran slow, and that the coffee from the third-floor break room was always better than the coffee from the machine in the lobby, because someone on the night shift kept restocking it with the good stuff. She knew the names of most of the security guards and all of the housekeeping staff on the day shift, and the 3 orderlies who always worked holidays because they'd volunteered to, so their coworkers with kids could be home. 4 years. And they had walked her out with a box that held a coffee mug, a framed photo, and a plant that was probably already dead. She was still sitting in the car when her phone buzzed. A text from a number she didn't recognize. "Lobby. 5 minutes, come in the main entrance." She stared at it. Then she got out of the car. There were 4 of them. She saw them the moment she came through the main doors. You couldn't miss them, honestly, because they were not dressed like anyone else in that lobby. 3 of them wore Army combat uniforms, desert pattern, the kind that meant they'd been somewhere recently that was not a desk job. The 4th wore civilian clothes, but stood the way military people stand, which is a particular way that has to do with both posture and stillness, and a kind of general awareness of the room that most civilians never quite develop. Briggs was the one who stepped forward. He looked different in the daylight than he had on Tuesday night, younger, somehow, or maybe just less shattered. He was wearing his uniform. His hands were not shaking. "Mrs. Weston," he said. "Sergeant Briggs," she said. "You remembered my name. I remember everyone's name." He nodded, like that confirmed something he'd already suspected. "I want you to meet someone," he said. He half turned, and the man in civilian clothes stepped forward, and he had the kind of bearing that made Tara think of the word command before she thought of anything else. "Colonel Randall Oakes," the man said. "Fort Campbell, 160th SOAR." He held out his hand, and she shook it. "I understand you saved my unit's dog." "I stabilized him," she said. "The vet saved him. You bought him enough time to get to the vet." Colonel Oakes's voice was even, measured, the kind of voice that had given a lot of orders and received a lot of bad news and found a way to keep going anyway. Doctor, Brennan tells us that without the intervention you made in this lobby, Kodiak would have bled out before he reached her. A beat. That's not stabilizing, Miss Weston. That's saving. She didn't know what to say to that. She wasn't sure there was anything to say, so she didn't say anything. We had a conversation, Colonel Oakes said, with the administration of this hospital, earlier this morning. Tara looked at him. We had some questions, he said, about the decision that was made, about the rationale, about whether this hospital's leadership understood the full weight of what happened here on Tuesday and what the appropriate response to that weight would be. He paused. I'm told that conversation was productive. The lobby doors behind her opened. She heard footsteps and turned. And Carol Maddox was walking across the lobby with an expression that Tara had never seen on her face before. Not the expression she wore in her office, the one that said, I have been an administrator for 11 years, and I have seen everything, and I am not moved by any of it. This was a different expression. This was the expression of someone who had very recently been made aware of information they wished they had possessed several days earlier. She stopped a few feet away. She looked at Tara. She looked at Colonel Oakes. She looked at Tara again. Miss Weston, she said. Her voice was careful. Every single word of it was careful. The way you are careful when you are walking on a surface you've just discovered is much thinner than you thought. The hospital's review board met this morning. After reviewing all available information about the incident on Tuesday evening, the board has determined that the decision to place you on leave and subsequently terminate your employment was made without full consideration of all relevant context. A pause. We would like to offer you reinstatement at your previous position with back pay for the period of your absence and a formal acknowledgement from this administration that your actions on Tuesday night were, another pause, a longer one, consistent with the values this hospital holds. The lobby was very quiet. Tara let it be quiet for a moment. Consistent with the values this hospital holds, she repeated. Yes, the values that were, as recently as Monday, described to me as the reason I needed to be terminated. Carol Maddox's jaw moved. I want that in writing, Tara said. The acknowledgement. I want it in writing, signed by you and by the board chair, and I want it in my personnel file, and I want a copy. She paused. I also want a formal policy review, an actual review, with outcomes, about how this hospital handles situations that fall outside standard protocol. Because what happened in that lobby on Tuesday is not going to be the last time something unusual comes through those doors, and I'd rather we have a plan for it than find out in another crisis that we don't. Carol Maddox looked at her for a long moment. That, she said finally, is reasonable. Tara turned back to Colonel Oakes. How is he? She asked. Kodiak. Something changed in his expression. Not much, he had a lot of practice keeping his expression level, but enough. He starts physical therapy next week, he said. The vet says he'll make a full recovery. He may not return to active duty. A beat. Briggs is being reassigned to the same unit. He's requested to stay close during Kodiak's recovery period. She glanced at Briggs. He was looking at the floor. He's a good handler, Colonel Oakes said. One of the best I've had. Briggs said nothing. His jaw was working. Tara looked at him for a moment. Then she said, You did the right thing, bringing him here. You made a call in a crisis. That's what good handlers do. Briggs looked up. He had the same look on his face that he'd had in the lobby on Tuesday night, just underneath the surface of it, just barely controlled. He's going to be okay, he said, like he was still convincing himself of it. He's going to be okay, she said. She went back to work on a Monday. The shift started at 7 in the morning, same as always. She had the same badge, same locker, same station on the floor. The supply closets were where they'd always been. The third-floor coffee was still the good stuff. Some things were different. The paperwork on her desk included the signed acknowledgement, exactly as she'd requested, with both signatures and a date. The policy review had been scheduled for the following month. Dr. Lind, who she'd always gotten along with reasonably well, nodded at her in the hallway and said, Glad you're back, and she believed him. A few things were different in ways she hadn't anticipated. The housekeeping staff on the day shift threw a small, impromptu, entirely unauthorized welcome-back moment in the break room. Someone had brought donuts, which was a serious breach of the informal coffee room politics of the third floor, and absolutely everyone was there for it. The security guard at the main entrance, a man named Pete, who had worked there longer than Tara had been a nurse, told her he was glad she was back, and then immediately looked embarrassed about having said it. She was in the middle of a charting session later that week when her phone buzzed with a photo. Unknown number again, but she'd saved the contact now. The photo was a German shepherd lying on what appeared to be a veterinary therapy mat, his left foreleg wrapped in a clean bandage, and his head resting on the knee of a young sergeant in civilian clothes. The sergeant was looking at the camera with an expression that Tara could only describe as a person who has been through something and come out the other side. Kodiak was looking at the camera too. His ears were up. Below the photo, the message read, "Day 1 of PT. Vet says he's already ahead of schedule. Wanted you to see." Tara sat with the photo for a moment. She was in the middle of a charting session, which she would need to get back to shortly, and the afternoon shift was already starting to bustle, and there was a patient in room 4 who needed her in about 15 minutes. She typed back, "Tell him I said keep working." Then she put her phone away, and she went back to work. The policy review happened in November. Tara presented 3 recommendations to the board, and the board adopted all 3, and the document that came out of it was dry and administrative and contained the specific words "good faith emergency intervention" in a context that made them mean something. She wasn't sure that Carol Maddox would ever like her. That was okay. She hadn't become a nurse to be liked by her supervisor. She'd become a nurse because of her grandmother, and the neighbor, and the understanding that showing up for people, for creatures, for living things that needed someone to show up, was the only work that had ever made sense to her. She got another photo in February. Kodiak in the snow outside what looked like Briggs's off-base apartment, his front paw extended carefully, testing the texture. His bandage was gone, his ears were up. He remembered snow, the message said. First time since before the deployment. She was working a night shift when it arrived. The ICU was quiet the way it gets at 3 a.m., that particular humming quiet that she'd always found oddly comforting. All those machines keeping vigil, all those people resting, and the nurses moving through it like they'd always moved through it, like they'd always known how. She stood by the window and looked at the photo for a minute, at the dog in the snow with his ears up and his paw extended, and whatever passed for joy in the face of a German shepherd who had seen some things and come through them anyway. She thought about that a lot in the months that followed, about what it means to show up, about how the smallest decision, to kneel down, to stay, to use what you have, can be the one that holds, about how most of the things that matter don't come with paperwork or authorization or clear protocol. They come in through the emergency bay doors at 11:47 on a Tuesday night, and you either meet them where they are or you don't. She had met it where it was. That was enough.